Hi, I'm Dr. Angel Bice, and I'm going to be giving a presentation on ears, eyes, and the urinary tract system. I currently work at Charleston Animal Society, so if you have any questions, feel free to reach out to me there. So ears in general. So I'm starting off with the anatomy of the ear because I always like to let everyone know that you don't have to worry about cleaning dogs' ears and cats' ears like you do people. So our tympanic membrane, which is the eardrum, is pretty close to where the opening is. But on dogs and cats, their ear canal is kind of this red pink spot right there. So it goes down and then it's shaped like an L and then it curves and it goes all the way down. So it's pretty hard to get far down there. So feel free to clean out animals' ears without concern like you would for people for causing damage to that. And so here at the top is the PINNA. So that's the dark brown area up there. So that's our PINNA. And then the pink part is our ear canal. And that's pretty much what we're going to focus on, nothing crazy. For the anatomy, the PINNA is that top of the part at the top that's shaped as the opening cover. And then you have the L-shaped canal that goes down, and then you'll hear the tympanic membrane referred to as also as the eardrum. So clinical signs. Most of the time, the animal has normal behavior. So this is just something that we look for whenever we're doing physical exam or we're just looking over the animal on intake. So it's something that you have to look in the ears for. Some animals will present with clinical signs, and that's going to be shaking their head, scratching at their ears. Sometimes they just act like some people say that it's an aggressive animal, but they might just be really painful in their ears. So taking that time to look in the ears might help us identify that situation. Usually you'll see some visible debris, or sometimes you'll just see red inflamed tissue in the ears. But most of the time, they're going to have normal behavior, and we're just going to catch it by looking in there. So the ear PINNA. So the point of my presentation is, I know that you guys are not veterinarians necessarily to do diagnoses, but to be able to describe what it is that you're seeing to maybe your veterinarian that's on call, or to put in the notes so when your doctor comes in, they know what it was that you were describing. So using some words that describe the lesion are definitely more important than trying to guess what it is. Like it looks like it has rabies or ringworm, fly strike, things like that. By saying what it is you think it is doesn't mean that's what it is. So try to describe the lesion. So for this top one, you would say that this ear PINNA has hair loss with crusty lesions. And that would help describe what the situation is. So a lot of the times people like to say, it looks like it had fly strike, and that doesn't describe the lesion as well. So an ear hematoma, I'm sure most of you guys have seen these, so that's the fluid-filled ear PINNAs. And sometimes animals have a defect. So they may have had a wound to the ear PINNA, or they might be a left ear-tipped feral cat. So those are things that we would like to note on the intake exam. So the ear canal, so we have debris. So the first dog has a lot of red inflammation in the ears. The next one has dark brown debris in the ears. And the next one is purulent or pus discharge from the ears. So instead of just saying there's debris in the ears, taking the time to describe what it looks like really helps out a lot. So the eardrum, the tympanic membrane, is the term for the eardrum. It's important to note whether it's intact or not to help you make choices on the medications that you might choose to use. So some medications, if the eardrum is ruptured, will cause deafness. So that's obviously something that we're concerned with. That's why it's important that we take the time to check the tympanic membrane to make sure that it's intact. Now that's something that your veterinarian will do, but you have the choice of choosing cleaners and treatments that are safe to use if the tympanic membrane is ruptured until you have that information. So sterile saline can be used to flush the ears if the tympanic membrane is ruptured, or anything with the TRIS EDTA ear flushes. Those are the only safe ones if the tympanic membrane happens to be ruptured. So those are good choices to use. So eyes. So for the eyes, the important part about noting the anatomy is so that you can use your descriptive words best possible. So you have the eyelids around the top and around the bottom. The sclera is what's referred to the white of the eye, so the sclera part. The conjunctiva is the pink tissue that's on the inside of the eyelids. The iris is the color part of the eye, and then the pupil is in the middle. And so most of the eyelid things, what I'd like to take out of this for eyes in general is to know when something is an emergency and needs immediate attention, and then when something is not, and treatment can be started in the meantime until someone can take a look at it. So eyelids are rarely an emergency, so we're not going to see a lot of emergencies with those, but you will see lots of abnormalities. So eyelid agenesis is where the eyelids are not completely formed, and instead the hair, the fur, touches the eyes because they don't have that eyelid margin. So most frequently we see that in cats, and we have probably 10 or so a year that come through here that have the eyelid agenesis. We end up sending them to the specialist, and they do a cryotherapy where they freeze those hair cells so that they won't grow back. That way they don't have the rubbing out of the eyes, and that's usually curative. But these animals come in and their eyes are usually very irritated from the skin or the fur having rubbed the cornea for a long period of time. So just take a look and make sure that their eyelid margin is actually completely all the way around, something that you can catch by looking up closely. So in tropion, Shar-Peis are the poster child for this, for all their wrinkles. And with entropion, they have too much eyelid skin and it causes their eyelids to roll in. So they do have an eyelid margin, but the fur ends up rubbing the eyes because of the extra skin. So that requires a surgical procedure to take some of the extra eyelid away so that it doesn't rub the eyes. And then microphthalmia is another one that we frequently see. A lot of people say the cat, usually it's cats that we see, do not have eyes, but they usually do have a globe back there. It's just much smaller than what it's supposed to be. So micro, it's smaller formation of the eye than what it should be. So third eyelids, or also referred to as the nictitating membranes, a lot of the times the notations that you'll see on intake for these are that they have raised third eyelids, or that they have apoptosed third eyelid gland or cherry eye. So those are the most common situations with the third eyelid, is that they're either raised due to the animal not feeling well. Having internal parasites can also be a cause of the raised third eyelids if the eyes look like they're completely healthy otherwise. And then also having that cherry eye, that prolapsed gland. So the conjunctiva. So frequently we see, especially with kittens during kitten season, a lot of cats that come in with that swollen pink tissue. And that can be from chlamydia or it can be from a virus such as herpes. So there's lots of causes. But one of the things that you're going to see happen secondary to the conjunctiva is whenever it's swollen and inflamed, it can start causing adhesions, which is the symblepharon at the bottom. So that's where the eyelid actually starts causing adhesions to the cornea. It's important to go ahead and start antibiotics in these eyes, but you do not want to use anything that has a steroid or anti-inflammatory property to it. It actually allows the virus to get deeper into the tissue. And then trying to fix the symblepharon adhesions before they're 6 months old has shown to not work very well, and they tend to have to go ahead and wait till they're 6 months to have those adhesions released, otherwise they just re-adhere. So they come in looking a little scary, but it's something that we can control the comfort level with, and it's not an emergency. So the sclera, the white part of the eye. So you can have scleral injection, which is just usually from something very irritating to the eye. That's where those vessels are much larger than they usually are. Scleral hemorrhage or bruising, we've seen this on dogs that are brought in on catch poles. So that's something to look for and note if you see it. And you can have scleral pigmentation, especially like in pugs and other dogs like that, where you have the brown spots on the scleral area. So that's something that you can notate on intake. The iris, so this is the colored part of the eye. It gives the shape of the pupil, so the iris is changing shape, and that's what makes the pupil look like it's a different shape. It's never an emergency, but it can give us information that there's something going on with the animal. So iris defects are usually congenital. So here, on the very first picture to the left, you have adhesions of the iris to the cornea. The cornea is the clear globe part. And so you have iris adhesions there. That's called synechia. Just a fun term, but there's nothing that you can really do about that, and it doesn't affect the animal's comfort or anything. So that's something that we're just going to leave alone. And then here we have a coloboma in the middle, and that's just an iris defect where a piece of it's missing, and it makes the pupil shape look different. You can have iris atrophy, which is the cat that's next, and it doesn't really have an iris. So the iris can atrophy away, so it breaks down, and then there's no iris, so then the pupil is left completely open and dilated. And then iris bombay is where you have inflammation and the iris bubbles up. And then right here you have a beautiful cat that has two different colored eyes, so that's something that you'll see sometimes too. And the cornea. So the cornea is the part that's the most critical. This is the part that's going to make a difference as to whether or not that eye is going to be able to maintain its shape, and if we're going to be able to keep that or not. So this is where we come into our emergencies. This is where we start getting worried. So usually it's the source of an eye emergency. If we have an emergency, it's because the cornea is affected. This is the thin outer layer of the globe. If you have a blue eye, that's something that you might see in puppies due to adenovirus. And so keeping an eye on that, if you wanted to treat that, usually it means that there's an edema, so there's a buildup of fluid in that eye. So that's something that is definitely of concern. So eye ulcers, definitely in kittens, you'll see these throughout the year where they have a defect in the cornea. One way we can check that is with staining. So we can use our fluorescein stains, and that tells us for sure. This picture here in the middle is a very obvious ulcer. They're not always that obvious. So you use the stain to tell if there's a defect in the cornea or not. That's a simple test that can be done with just a drop of the fluorescein. You do have to have an ophthalmoscope with kind of a blue light on it so that you can see the highlighted colors of the green. If there's green uptake, that means that there is an ulcer present there. And that's going to make a difference on which antibiotics that we choose. So if your staff is trained to be able to do that stain, then that gives the veterinarian important information so they can go ahead and start coverage. So you can have a cloudy eye here at the bottom. On the left, this cat you can see here has definitely some cloudiness compared to let's say that'd be his left eye compared to his right eye. And that's something that we would like to address as soon as possible because that can add, build up and cause the globe to give or build up pressure in that eye. Here, this next cat, it's actually a nicocoria. So that means the pupils are two different sizes. So we know something is going on with this cat that's serious. And that's something that we not necessarily has to do with the cornea, but it's something that we want to take into consideration that an emergency could be in place with this cat as they have some kind of nerve damage that's affecting them systemically so that one of their eyes is constricting more than the other. And then down here we have a little kitten with a ruptured globe. So that's always an emergency, something that we want to address as soon as possible. We don't want it to become more infected, and we want to make sure that their comfort level is doing well. So eye discharge. So you'll frequently hear people use different words to describe eye discharge. And you'll see notes that say just discharge from eyes. So it's important to have an idea if it was just clear discharge, if it was green in color, how thick it was, and what else was going on with the rest of the eye. So clear discharge, I frequently hear people say they have weepy eyes. And so clear discharge would actually be the description for that. So eyes that have the clear discharge is usually viral. And then you have down here green, which is going to make a difference because that lets us know that there's some kind of infection going on or extreme mucus buildup. So giving the color description also helps in the volume of discharge that's present. So when it's an emergency, so these are the most common emergencies. These are when you want to send to the emergency clinic or call your on-call vet right away, or get the attention of your veterinarian if they happen to be there. So a proptost eye is an eye that's out of the socket. We see these a few times a year, and we're actually usually able to save this eye. So if it's addressed quickly, we can actually save this eye and keep that animal's vision in that eye. So that's something that you want to address as soon as possible if you happen to have one come in. An eye ulcer is another one that the globe of that eye is going to give at any moment if it's not treated aggressively. So you want to get the attention of someone and get medication started as soon as possible. One thing that we do here is we take dogs, draw blood from dogs, we spin it, and then take the serum and freeze it, and we use that for eye drops for whenever we have to go with the rest of the treatment plan. But that's one of the things that we use to treat our eye ulcers is serum. We can't get enough of it from the individual kittens usually, so we started collecting it from dogs and keeping it in the refrigerator and the freezer. And we send that home for eye drops whenever we have ulcers to go with the rest of the medications. So if you have glaucoma, which is a bulging eye, it can lead to a rupture, but it's very uncomfortable. So that can be extremely painful. And if it just started, then you have a short period of time that you can catch it before you can cause a rupture. Some of the glaucoma eyes have been going on slowly. They're chronic over a long period of time, but they're still very painful. So that's something that you want to get the pain under control and try to get the pressure from that eye brought down as soon as possible. So urinary tract disease, something that is always questionable. There's lots of animals. Sometimes they're just stressed out, or sometimes it's more. So that's how we need to take this serious and try to determine what is going on. So when to worry. No urine produced for 24 hours is always an emergency. And usually you're going to see signs of them straining to urinate. So they'll keep going to the litter box and keep trying. And you can tell that they're very uncomfortable. Sometimes we have cats coming through the shelter and we'll see signs like has not urinated in 24 or 48 hours. And the cat's comfortable and it's fine. And usually that just means they didn't urinate inside their litter box, but they have urinated within their cage somewhere. So differentiating between those is important. If they are producing urine, then it's not an emergency. But if they are producing no urine, then that's absolutely an emergency that needs to be addressed right away. And that's usually going to be your male tomcats. So those are the ones, or a male neutered cat, but those are the ones that are the biggest emergency. So if there are large amounts of blood in the urine, it could be due to multiple causes, but usually you want to address that as soon as possible. There's always something underlying that's major if they're seeing large amounts of blood. Sometimes that's going to mean that they have bladder stones, or kidney stones, or ureter stones. So usually that's something that's very uncomfortable and something significant is going on with that. So you can do a urinalysis, so perform a urinalysis on any animal with abnormal urine behaviors, and that's always a great start. So this is something that your techs can usually do. So check the urine-specific gravity with a refractometer. So don't go by the strip that has the USG on the strip because that's not going to be as accurate. With the refractometer, you just need one little drop and it gives you a much more accurate number, and that's very helpful information. So performing a urinalysis, keep in mind that there are things that are zoonotic, such as leptospirosis, which could be deadly, so make sure that you wear gloves anytime that you're handling these fluids. So indications on when to do a urinalysis. So anytime that the animal is straining to urinate, or they're not urinating in the place that they should be. So if they're urinating outside the litter box, then let's go ahead and check the urinalysis just to rule that out. If they're urinating more frequently than normal, if you notice that they're drinking a lot of water and their urine looks more diluted or more concentrated. So any of these things could be signs of reasons to check for urine. If you're being very progressive and you have the time and you wanted to do a urinalysis on every geriatric animal that has anything going on, that can be valuable information. So always provide a history of the problem and description to go with the urine, not just the urinalysis, so that the doctor can have an idea of the situation if the animal is a very stressed animal, if they're just urinating outside the litter box, if they've been noticed to be straining to urinate multiple times throughout the day, all that's useful information. So give a history to go with the urine as well. So you want to mark down also what the urine looks like. So that can make a big difference. If it's clear, cloudy, orange, neon yellow, red, brick, dark red, or brown. And then performing the urinalysis. So free catch is the most common. Definitely wear gloves. Use a large container. We like to use the vaccine trays. So the top part, empty part of the vaccine tray is a good one. That gives you a little bit more space to put it under there without having to get it on you. So use your sample and then put any remaining sample in the refrigerator. So if there's any questions or it needs to be redone, there's more sample there. We can use urine collecting beads. That's something that you can purchase, plastic beads, to put inside litter boxes for cats. That way the litter doesn't soak up all the urine. Another thing that you can do is we take old IV lines and cut those into small pieces and put that inside the litter box for the cats as well. So the refractometer is something that you use to get the USG. You put just one little drop on the refractometer, look up at the light, and that'll give you a line that shows you where that concentration of the urine's at. So you just write that number down for your veterinarian to review. So the urinary dip strips, you don't trust all of the pads that are on there, but there's some very helpful information. So the leukocytes tend to not be accurate. In cats, it's always going to say that there are leukocytes, which are the white blood cells. So it's going to give you the false impression that there's a urinary tract infection. So I wish that's one we could trust, but it just isn't. So write down all of your findings so that your doctor can differentiate. But the only ones that we really trust and look at are the pH, the glucose, the blood levels, the ketones, and the bilirubin can sometimes be accurate. Sometimes the bilirubin can be off. So this is another very important step that gets missed frequently, but you definitely want to do the sediment and take a look at that microscopically. And that's where you're going to be able to tell if there's really bacteria, white blood cells, or if there's cast inside of the urine. So that part's going to definitely take more training, whereas the rest of the urinalysis can be done by any staff member. You might need a certified vet tech or train someone particularly to be able to do the microscopic description of what you're seeing under there. And again, you're going to keep that sample in the refrigerator, so if you needed to do just the first parts of the urine strip in a refractometer, you can leave a sample for your veterinarian to review the sediment under the microscope. Well, that's all that we have for today. If you needed to contact me for any questions, it's abice@charlestonanimalsociety.org. Thank you.